This small corner of Baltimore City had been the epicenter of African American life and development for decades.
You had a neighborhood that was historic in that you had a lot of people come from that neighborhood, including Cab Calloway, Thurgood Marshall, a number of others, Billie Holiday. And of course, we know what they've gone on to do in terms of changing really life in America.
But through the years of disinvestment, families in this proud neighborhood, rich and robust with history, have found themselves living in a community that lacks essential resources.
Where I live, it's nice, but the neighborhood, I don't really like it there because we have to hear gunshots a lot of times.
A strong and vibrant Baltimore requires children who are healthy, educated, and ready to enter the workforce. Yet in the West Baltimore community of Upton, Druid Heights, 62% of children live in poverty, and more than 95% are not proficient in reading and math. Children are expected to achieve their full potential on their grit and resilience alone, while still facing many hurdles to their education. Inadequate schools, violence at home and on the street, stressed parents, limited recreational opportunities, and deficient health care.
The health indicators in this community show that a child born in this community would have a life expectancy of just 66 years. But if a child was born in Roland Park, they would have a life expectancy of 86 years. So there was a 20-year difference, and we're only talking about a distance of 4 miles.
Between 2005 and 2009, for every 1,000 births in Baltimore City, there was an average of 12 newborn deaths. One of the highest infant mortality rates in the country, higher than the rates of some developing countries. And in Upton, Druid Heights, the numbers were even higher.
Our church, Union Baptist Church, has historically had a very good relationship with the University of Maryland, Baltimore, as well as the University of Maryland Medical School. There's been a healthy relationship. So I went there and talked to them.
We were looking at what could we do in the community, and specifically what could we do in West Baltimore in terms of really trying to change the outcome for children and families.
Through that partnership, a seed was planted, and what grew has saved lives and given hope to a whole community. Started by the University of Maryland School of Social Work, Promise Heights is a place-based program in this small section of the city, helping families throughout all stages of life.
With our pipeline of services, we really start with the beginning of life, so it's really cradle to college to career.
Promise Heights officially began in 2009 with Be More for Healthy Babies, an innovative initiative to reduce infant mortality in Baltimore. The initiative is funded by the Baltimore City Health Department and the Family League of Baltimore, and provides group-based educational programs and one-on-one case management geared toward policy change, service improvements, community mobilization, and behavior change. By 2016, the Promise Heights Be More for Healthy Babies staff helped reduce the infant death rate in Baltimore City by 21%, and in Upton Druid Heights by 43%. And between 2011 and 2018, Upton Druid Heights has had only one infant sleep-related death on record.
Hello, I'm Wendy Lane, one of the co-investigators of Be More for Healthy Babies Upton Druid Heights, along with Bronwyn Maiden, who you met earlier. I'd like to tell you a little bit about our program and share some of our outcomes. But first, we need to recognize our main partners and funders who are listed on this slide. Be More for Healthy Babies Upton Druid Heights is part of a larger citywide initiative to improve birth outcomes in Baltimore City. Its vision is that all of Baltimore's babies are born at a healthy weight, full term, and ready to thrive in healthy families. Our intervention has consisted of 4 key components. First, we do extensive community outreach. Pre-pandemic, this involved participating in community health fairs and school events, visiting childcare and community centers, and going door to door to educate residents about healthy pregnancy and childhood. Our staff run group activities, including prenatal and postnatal education and support groups, breastfeeding support, and Circle of Security, an evidence-based parenting intervention. If interested, pregnant women can also receive individual support from community health workers who assess women's strengths and needs and help them access services. Finally, we have strong connections with organizations and individuals in the community. Our program has a strong community participatory component. We work with a community collaborative of community agencies and organizations. We also meet monthly with a neighborhood action team of community residents who provide feedback and make recommendations about program direction. These are just some of the community partners whom we work with. Over time, we have seen decreases in substance abuse, secondhand smoke exposure, depressive symptoms, and food insecurity. 53% of our moms initiate breastfeeding, and nearly 30% have continued breastfeeding at 3 months postpartum. Our infant mortality rates have dropped dramatically over time. For example, the 5-year average infant mortality in Upton Druid Heights has dropped from 14.1 per thousand to 7.2 per thousand births during the first 10 years of our program. Rates of unsafe sleep deaths have dropped in both neighborhoods. Preterm birth rates have dropped slightly in Upton Druid Heights, while rates in other high-risk neighborhoods have risen. Similarly, low birth weight rates have decreased in Upton Druid Heights, while rates have gone up in other high-risk neighborhoods. Finally, our breastfeeding rates have increased, thanks in part to our community-based breastfeeding support. Let's now hear from Stacey Stevens, our project director, about our response to the COVID pandemic.
For the past 9 years, Be More for Healthy Babies at Promise Heights has been actively involved in ensuring that every baby in the community of Upton and Druid Heights is born healthy and able to live in a thriving family. Our place-based program is a part of the University of Maryland's School of Social Work's Promise Heights initiative, whose overall goal is to improve the health, social, educational, and financial well-being of families who reside in the communities of Upton and Druid Heights. Be More for Healthy Babies is the cradle portion of this work, and we actively collaborate with families, community members, faith leaders, businesses, schools, and health practices to improve maternal and infant health outcomes. Prior to COVID-19, our team was very much aware of, and we were actively addressing the impact of the social determinants of health on disparate health outcomes in the African American community. We provided direct services in the form of non-medical case management services, referral to our community partners, and a host of group-based activities to support the needs of expectant and parenting families with children ages 0 to 3 years of age. Our work occurs in the community, in local schools, public housing complexes, barbershops, churches, and recreational centers. The Be More for Healthy Babies team is comprised of community health workers, social workers, peer leaders, and 2 certified lactation counselors. Over a 3-month period of time, we generally host or co-host 25 activities to deepen our community engagement. As a result of the pandemic, we transitioned all of our group-based activities to a virtual learning environment. We currently host prenatal, postpartum, breastfeeding, parenting, and community partner meetings, all online. Our community outreach continues in a safe manner by sharing pertinent health messaging with community partners and residents online via social media and text messages. We continue to support participants' needs by providing contactless door deliveries of essential household supplies, breastfeeding supplies, and cribs to our families. In addition, we have addressed food insecurity that residents may have experienced as a result of the pandemic by redirecting grant funds to provide nutritious, hot meals for approximately 150 people at the end of each month. In response to an increased need of families dealing with stress, grief and loss, and coping with life adjustments related to the pandemic, we have created virtual support groups and check-ins to support the mental well-being of our families. Lastly, we have experienced growing participation in our resident-led advocacy group, the Community Achievers, who provide invaluable feedback to the current and future development of BHB programming and policy initiatives. We will now hear from Celestine Tolliver, who who was one of our community health workers.
We educate our community and spread the BHB information in many different ways. We go in the neighborhood and we do door-to-door door hanging with our information. We also put information in the business as far as red cards, tear-offs, and flyers. When we do food deliveries, we add our information in as well. We share messaging on social media, which is Facebook, Instagram, and Twitter. We share with our partners so they are able to share with their families. We do presentations also. One of our best ways of getting our information out is through our families and our peer leaders, word of mouth, where they share with their friends and family, which is a good look. We also do parenting groups, Circle of Security, Parent Cafe, Baby Basics, and Postpartum, where each group we share our information with our families also. Now we will hear from Angelique Shelby.
Since the start of the pandemic, it has been very important to increase our social media presence in order to outreach new clients, as well as remain engaged with existing clients and partners in the community. We are active on Facebook, Twitter, and Instagram, and included are a variety of posts like the events that we're hosting, or prenatal or postpartum groups, BHB messaging such as Safe Sleep, and where to find resources in the community like food or employment. Social media has also proved to be an important factor in our engagement with our young parents. With all of the changes in recent months, it has been instrumental in helping us stay engaged with the youth. Our young parents have been able to receive support with everything from discharge paperwork, leaving the hospital after delivery, to issues in school. We have continued to work with them in a socially distanced manner through one-on-one groups and virtual settings. Staff has continued to work with Baltimore City Public Schools staff to assist students with the transition and continuation of virtual learning. For our spring and summer 2020 graduates, in lieu of an in-person celebration, celebratory baskets were delivered door-to-door. Throughout the pandemic, whether it be a resource that we can provide or making a connection to another resource in the community, we're committed to ensuring our parents have the resources necessary to be successful in their parenting journey. Now you're going to hear from Blair Davis.
And over the last several months, we've really had to reckon with the isolation, loss, and uncertainty that folks have experienced in the midst of COVID-19 and quarantine. So we focused efforts on addressing mental health and well-being, firstly by offering bi-weekly virtual support group sessions that we've called This One Is For Me. And that group aimed to give people, that might be community members, staff, or partners, time carved out to focus on introspecting, sharing, and community building. We also offered a virtual summer series called Together Time, and over the span of several weeks, we focused on meditation, breathing techniques, and relaxation with the support of our partners at Just Be. We've also built a neighborhood action team called the Community Achievers to allow community members to lead advocacy efforts and address changes that they'd like to see in Upton, Druid Heights. We focused on learning about local government, civic engagement, and ways they would like to support the community. Our Community Achievers offer us guidance on ways that BHB and Promise Heights can improve on our service provision by participating on task force. And many are training in other areas and skill sets to help ensure that power is being shared and capacity is being built within the community.
We really appreciate you spending the time with us and hearing about Be More for Healthy Babies. Have a great day.